Treatment. It is important to spend time initially to evaluate patients. There may be underlying veins which are not working properly, and these have to be identified and often dealt with at the beginning. Proper evaluation on the first visit will lead to better results and longer lasting results. This is akin to using a map or GPS to properly guide you from point A to point B. The treatment of veins, I often tell patients, is similar to pruning a tree. You must start with the trunks and then go to the branches and finally treat the leaves. Simply treating what you see, or the so-called shotgun approach, is not the way to go. Spider veins are not always as easy to treat as they may appear, and often there are deeper veins feeding into these veins. The best approach is the one tailored to the patient. So to treat spider veins or reticular veins, or otherwise known as surface veins, the treatment is carried out by injections or sclerotherapy. Most of the time, a substance known as thromboject is injected into the vein to provoke an inflammatory reaction and eventual closing of the vein. This is where the term sclerotherapy comes from, provoking a sclerus or scar within the vein. The injector must also treat the largest veins first, followed by the spider veins. Laser. Laser is often not effective as a sole treatment of veins. It is best reserved for the end when the largest feeding veins are treated and only the smallest caliber veins remain. Laser works well in these circumstances, particularly with a YAG 1064 or a pulse dye laser or even an IPL. Larger veins. Traditionally, only stripping was offered to patients. Options today for larger incompetent veins include stripping or surgery, endovascular thermal ablation, or echo-guided sclerotherapy. This is mentioned upon the first visit when the patient is examined. The alternatives to the stripping, the echosclerotherapy, or the endovascular thermal ablation is discussed in detail with the advantages and disadvantages at the time of consultation. Echo-guided sclerotherapy is the least invasive approach if the patient is deemed a candidate for this procedure. Wearing compression stockings can help attain results and diminish side effects post-sclerotherapy and diminish overall heaviness and discomfort, and often these are recommended at the time of initial consultation.